hardly believe I'm about to have breast augmentation. But I'm 30 years old, and before I had my kids, I was a B cup, and I'm a 32 AA now. I've got a lot of worries about the surgery and the pain afterwards. Cosmetic surgery is a big step, but I know it's going to be the answer for me. John and I came for our first visit with Dr. Altman. We're really looking forward to asking him some questions and getting some answers.
Great. I have 2 sheets here for you to fill out.
Hi, Lori. I'm Dr. Altman.
Hi, nice to meet you.
Nice to meet you. Where are you two from?
Claremont.
Claremont. You said that you're trying to restore some of the volume that you had before you had children.
Yeah, I just lost everything. So I just wanted to get back what I had.
We're going to put this implant, which looks something like this. It's a saline implant, a saltwater implant, behind the muscle on your chest wall.
It is very soft.
I'll draw you a little picture, which would be a side view here, okay? You have to excuse me because I'm not a professional artist, I'm a surgeon. Say this is the breast, okay? And say here's the nipple here, and this is the pigmented area, the areola. You have a muscle which kind of comes down like this. It really gets kind of thin down there at the bottom. So that's the implant behind the muscle. Now, the incision that we use is just around the areola. So if you imagine yourself on the side, it comes in like this. The breast tissue is split, and we go through the muscle and put in here. I think my preference for this incision is that it usually heals very, very well. Lori's procedure will probably be one of the more painful operations that's performed in plastic surgery.
Do you take the implant when it's deflated like that and fold it up and slide it in there?
There's a nurse holding some retractors,
okay.
And we actually fold this thing up like a cigar and put it straight in, and then it's allowed to unfold. Okay. It would sit about like that on a side view.
Well, how do you know if the implant's in there flat,
right,
and you're going to fill it up?
How do we know how much we're putting in?
Yeah.
We have a syringe that's calibrated, and we count. And these implants have a little leeway in terms of fill. If you can go up or down, you know, an ounce or two to try to get that even. Every patient that comes here follows a certain pattern of healing that's not predictable, and you always run the risk of having another operation. You're talking 10 or 15 years before you might have a problem, and hopefully you could go your lifetime. But I don't think it's fair. You're in the car business?
Right.
It wouldn't be fair to sell somebody a car and tell them that it would go forever. It's a man-made device that might need some maintenance. Have you given any thought to what cup size you want to be?
Between a small and full C.
Okay.
Is what I'm thinking.
Okay, are you ready?
I'm ready.
Okay. Because my idea of a C and your idea of a C might be 2 different things, and I'm going to try different ones, so don't let them scare you.
Okay.
So just lie this down flat.
Whoa! Definitely not. Look at that, honey.
At least it gives you something to compare it to. Most likely that's going to take you to like a full C for your frame.
Yeah. I like this one. I don't want to be too big. I don't want people to say, oh my gosh, look at her, you know.
What's most important is that you feel comfortable.
Yeah, that's perfect.
Looks more proportionate.
It does, it really does. Trying on the sports bra really helped me decide on my size and what I'm going to feel comfortable in. I was really nervous about that, but I'm pretty comfortable now. I'd make sure to let other couples know that are considering this to make sure they research and go to a few different consultations. I think the most important thing is having a great doctor.
I thought Lori was an excellent candidate because she wasn't looking to be sensational in her result, but she wanted to look natural. I think you'll be happy. No, I don't think it will. I think you'll do just great with that.
Okay. Hi. Hi. This is the price quote.
Okay.
And it's...
Whoa!
Scared me to death! We've been saving and robbed Peter to pay Paul, as my husband would say, and we'll take out a loan for the rest.
We also accept MasterCard, Visa, and American Express.
Okay.
It was a joint decision. I mean, I wanted to be happy.
He has a motorcycle, and I get breast augmentation. I think both benefit him in some way. I'm making out a list for our nanny so that she knows our daily schedule and their bedtime routine and kind of what they eat. They've only spent about one night away from us since they've been born, and very few hours during the day. I mean, they go everywhere with me. They're my sidekicks.
I'm going to take over the primary caregiving of the children while she's recovering. Everything, feeding them in the morning, to changing Nick's diapers and having them scream and cry and do all that stuff. My approach to making them happy might be a little bit different than Lori's.
Daddy tried to put him to bed last night and didn't work, did it? That's not their routine. That's not what they're used to.
Mommy has always been my dad.
She said when Mommy has her always, Daddy's gonna have to put me to bed. It's not just what I'm gonna go through, it's affecting all of us. And even though I'll be laid up in bed, I'll still feel that responsibility to put that smile on and take care of my kids. If I have to just grimps and bear the pain while I give them a hug. Love for your children is so immense that it overcomes anything that you're going through. I'm gonna cry. Right before surgery, as they wheel me in and get me ready, I'm gonna be panicking. I'll be excited, nervous, scared. The anticipation is a lot to deal with. Start bawling. Today's gonna be a hard day. Who's that? Who's at the door? Who's at the door? Let's go see. Let's go see. Who's there? Oh, now Cole's awake too. How are you?
So they have baths at 7 and go to bed 7:38.
Yeah.
And then your mom and dad will come back. Okay, we'll come back. Okay, that's a good deal.
Good boy.
They'll be right back.
Okay.
It's okay.
I love you.
Oh, she'll be back.
It's okay.
She'll be back.
I love you.
It's in the garage.